Welcome everyone to the third Pandemic Perspective Seminar of the autumn term 2021-22. Today's a really interesting paper. I'm going to introduce the speaker in a moment, just to start with a couple of ground rules, as it were. I'm sure we're all used to using Zoom and kind of précis of how this is going to work tonight's event. As you know, we're recording. The recording will only be of the talk itself. Following the talk, we're going to move into, it'll start as a bit of Q&A, hopefully it'll turn into a discussion, but that'll all be, off the record, as it were. So, please contribute mics and cameras on if you feel comfortable, because that'll just be here on Zoom, as it were. And afterwards, the recording of the event will be up on YouTube, on the Pandemic Perspectives YouTube page. We have, as I say, just normal Zoom rules apply. Keep mics off during the presentation is always helpful. You can put your cameras on if you want, although if there's technical difficulties during the presentation, perhaps take them off, because sometimes it can kind of just help the flow of whoever's speaking, as it were, with the internet connection as it goes. I think that's kind of it, actually, insofar as what we need to go. I'm sure everyone, as I say, is used to using Zoom, so we're all aware of what might happen, but obviously we will endeavor to rectify connection issues or anything like that as soon as we can. So to move on to tonight's speaker is a lecturer at the University of Edinburgh Napier up here in Scotland. She is also a visiting fellow at the Centre of Death and Society at the University of Bath, where she completed her doctorate. She's on the steering committee of the Challenging Research Group based at Birkbeck and University of London. And she was formerly indeed in London at the University of Greenwich as a lecturer and senior lecturer in social work. Tonight's paper is based on a recent article, Social Death in 2020, COVID-19, Which Lives Matter, Which Deaths Count, which is available in the collection Death, Grief and Loss in the Context of COVID-19, published by Routledge this year. And she's previously published a special issue on social death with the Contemporary Social Science Journal, which indeed was also published by Routledge as a book, Social Death, Questioning the Life-Death Boundary. Tonight, she's going to be speaking on social death in 2020, COVID-19, Which Lives Matter and Which Deaths Count. Please welcome Dr. Jana Kravlova.
Thank you so very much, Richard, for such a fantastic introduction. I feel truly honored to be here tonight. Thank you so very much for inviting me to contribute to the pandemic seminar series. I'm absolutely delighted to be here. Thank you so very much. And again, a warm welcome from me. First and foremost, I would like to draw your attention to the fact that the following content may be upsetting for some of you. So if that is the case, please feel free to leave at any point, and please be sure to take a good care of yourself moving through the presentation. So to begin with, I will quickly just talk you through the structure of the talk. So first I'll talk about what is social death. Then I will frame it in context of the social policy, and then I will introduce some important theoretical concepts that may or may not be familiar to you. I'm aware that we have got a wide audience, so that is just to enable everybody's understanding. Following on from that, the talk will get quite theoretical, because I will introduce some very important scholars in social death. These are specifically 3 schools of thought and their exceptions. And then, of course, then I will analytically apply the social death theory in the context of impact of COVID-19 on the Black, Asian and minority ethnic communities and on older people. So without further ado, what is social death? I am aware that I'm talking to a varied audience. So in the simplest terms, social death means to be utterly dehumanized and treated as if you're less than human. Now, this may apply to individuals, groups, or whole populations. and the extent of their dehumanization may vary, but it is very severe, and most commonly it also means that their social identity, that is who they are, their social networks, that is who they know, their legal identity, that is their ability to exercise any rights, as well as any access to resources, such as financial or otherwise, are very severely compromised, to the point that such groups or persons have very limited ability to exercise any resistance or resilience or agency. And although they often do, the important thing is that any and all attempts to overturn their situation often remains practically and legally inconsequential. However, I must clarify that in the context of the following discussion, we will be talking about the way in which the lack of recognition of those who may be deemed socially dead is deficient in the social policy and in the social policy frameworks. But that does not follow that the examples that I will use to represent the analysis, they do not imply that these groups are socially dead, and that's very important to note. So to prevent social death, it is necessary to first recognize what is social death and sort of embed it in a social policy, and then second, to include it and establish it in the social policy frameworks. So in terms of social policy context, on the 30th of March in 2017, during a meeting in the UK Parliament about the cuts to welfare payments and the benefits and the sanctions, a minute silence was held to remember all those who died as a result of the welfare cuts and austerity measures, and that have become part of the UK policy landscape since the 2007 and 2008 financial crisis. So the fact that there was a minute of silence held in Parliament to honor those who died as a result of the cuts in a policy is, in my view, really that captures the very essence of the impact of social death, and it does provide a solid reason for inclusion of social death into the social policy. So there are no raising numbers, and the part of the reason for my research into social death is essentially to bring the attention to those who are, as it were, often invisible in these policy measures and frameworks. So I'll be a bit more specific now in relation to what policies I'm talking about. So the worldwide death in relation to COVID-19 are quantified by counting the death of people who test positive before or after their death. The deaths of people suspected to have COVID-19 based on the symptoms or those that are epidemiologically linked, or as by excess death, that is additional death compared with those in the same week in previous years. So in 2017, an Organization for Economic Cooperation and Development, known as OECD working group, aimed to define avoidable mortality. The group defines avoidable mortality through two key terms. One is preventable mortality. Also, they call it treatable or amendable mortality. So the cause of death in preventable mortality can be prevented through public health prevention. And it is that preventable mortality that is the focus of the following discussion. Okay, so we'll be talking about mortality that can be prevented through social policy. Of course, the treatable and amendable mortality is much more medical related, and it is the mortality that can be avoided through medical treatment, and that is not what we will be talking about here today. So the OECD uses the International Classification of Disease for its categorization of causes of death. And following the outbreak of the pandemic, COVID-19 had been given an emergency code as part of the ICD-10 10, while the 11th version of the ICD will come to the effect on the 1st of January 2022, for those of you who are interested in the details. Anyway, in simpler terms, we can also draw on the data from Office of National Statistics from July in 2020, which reported on socioeconomic inequalities in avoidable mortality, and this one was specifically for England in 2018. And what that report found was really alarming, which was that conclusively the proportion of avoidable death in 2018 in England is substantially larger in the most deprived areas of the country. So the lesser an area's deprivation, the generally decreased rate of avoidable death. So what that does, it raises a question whether how we approach the idea of preventable mortality actually reflects the lived social reality. Because clearly, it appears that social deprivation causes death. And therefore, I ask, should the social deprivation be considered a cause of death? And if it is, then should it be reflected in any of those policies, and how? And it is further evident that preventable mortality is hindered by not only socioeconomic inequalities, but also goes hand in hand with social processes such as structural violence and racism. And that leads me to define some of these a little bit tricky terms, which might or might not be familiar to some of you, or most of you, or none of you, as the case might be. So here we go. Just generally speaking, I'm sure you all know what the Black, Asian, and minority ethnic communities refers to, which is just that. But I just like to say I will refer to Black, Asian, and minority ethnic communities in the presentation, and I might use the short BAME for it. But I do so painfully aware that that is a term that is currently used but has got its shortcomings, and there is a need for extensive academic work to make sure that the term encompasses all minority ethnic communities. In terms of structural violence is the idea that the social structures such as organizations, legal frameworks, policies, and procedures have ability to obstruct people's lives, their opportunities, and might be discriminating or discriminatory against certain groups of people. In terms of agency in the context of this paper is thought to be an ability of a person or group to act on their wishes and needs, and have these satisfied in positive way and with the positive consequences. And the social vitality as a concept of Professor Claudia Card, essentially it is the opposite of social death, which is it is a ability of a person or group to live meaningful life of a good quality, in the simplified terms. So the very important critique of the medicalization of mortality has been discussed widely among many scholars, medical and otherwise, and there is a general agreement that there are certain groups that are not really reflected in the ways in which we amount for mortality, and some of these groups might be those who are hard to reach populations, homeless people, for example. Or others might be, those who are not living the lives that are sort of officially recorded, as it were, for whatever reasons. So in terms of how should we or could we possibly include these, these deaths, essentially, we're talking mortality measures, into the not only measuring, but also mainly protecting and preventing the social death from happening, I propose we use this concept of social death, and by no stretch of imagination have I invented this concept at all, and I will talk considerably at length in the following 10 or 15 minutes about who have done so. I propose we think about three major schools of social death, and the reason why I say that I spent some 15 years reading literature on social death, and I have come to understand that we can, generally speaking, probably group it into the broad three kind of schools of thought. And I'll talk you through the basics of these schools of thoughts, and I will try to show you how each one of them offers a very, very unique contribution and very specific kind of conceptual, analytical contribution to the concept. Okay, so I start with the first school of thought, which is represented by the work of Orlando Patterson, who is a Harvard professor. And as you can see on the screen, Patterson's work is in slavery, and it is internationally cited and a seminal work on social death. And recently I've looked up, and there is something like 5,500 citations on Google Scholar, but I have no doubt that that number is much greater. And what is very interesting about Professor Patterson's work is he roots firmly social death in a Black ontology, and consequently offers a Black epistemological framework. Now, I'm aware that these terms might not work very well, but given that what I'm talking about is in context of BAME communities, the power, and probably thus far unseen power, of the way in which Orlando Patterson conceptualizes social death lies specifically in the fact that his work is based in studies of slavery, and he is, you know, worldwide recognized scholar on the subject. And specifically speaking, his work is often cited not only in context of slavery, but also in terms of racial imprisonment, racially motivated lack of legal and social protection, racially motivated discrimination, also along with many others. Let me just say, for example, Patterson's work has been used in context of LGBTQI studies, refugee studies, also in the context of violence, political, economic, and otherwise. I could spend hours explaining how Orlando Patterson conceptualizes social death, but essentially, in his point of view, it is it is absolute domination of the human being and a substitute for death, essentially. Right. What the second school of thought represents isn't quite so well packaged, and that is because these sources come from all over the place, if you forgive me for the term. I was trained in a Center for Death and Society, as has been mentioned, and that is an interdisciplinary study of death and dying, and thus the resources are the combination of sociology, social sciences, some psychology, all sorts. But generally speaking, they fall under the umbrella of interdisciplinary studies of death. And I mean, many sources citing these cite 1, 2, 3, or sometimes all, or sometimes just some of those that you can see on the screen. But on the whole, the conceptualization of social death from the studies essentially tells us about, loss of persons' identity, about their inability to act on their wishes. It also tells us about how people interact towards each other. So a lot of these studies, specifically the Glaser and Strauss study, as well as Sudnos and Kalesh's, were actually done in hospitals, and they were done in relation to people who were close to death. And if I was just going to summarize the way this was thought about, it was sort of the idea that some people might be treated as if they're already dead, yet they are not biologically dead, but it is the kind of a disregard for a person. And you might start to see repeatedly occurring structural similarities here, whereby you might have experienced that somehow, somewhere, that somebody may have treated you as if you were somewhat less than human. They might have not acknowledged you when you came to the room. They might have not. And these are just a kind of microaggressions, whereas now here we're talking large scale. And you can possibly see how this really quite easily relates to things like discrimination, oppression, racism, but it does it in much more general terms. And what is positive about that is it enables us to include absolutely every human being without having to worry about what their identity or citizenship or whatever is. And that is the strength of this framework, which I have not seen elsewhere thus far. That is very fast and furious run through the studies literature. However, I should probably say that the common denominator about these death studies is it revolves around the loss of or maintenance of social identity, social connections, their legal identity, and their agency. Now, the third school of thought, and the papers that are using this as a main sort of source of social death definition and references, is from Professor Claudia Card, late Professor Claudia Card, and Claudia has done a lot of work around genocide, and I don't wish to go into the details of the atrocity paradigm, which is her seminal work, where she defines evil in a secular term, and she defines it as a reasonably foreseeable and intolerable harms produced by inexcusable wrongs. So we're moving into the area of philosophy, heavy going philosophy, but that is actually very important in terms of the moral implications of lack of social death and social policy. Because apart from the fact that Claudia also recognizes the seminal contribution of Orlando Patterson, she also gives us a theoretical sort of tools how to capture the harms that are done to communities. And although Claudia's theorization is in genocide, there are some lessons we can draw from her theoretical work. And her efforts can be broadly summarized as genocide as a consequence of damage to an environment, which is now more pertinent than probably ever in the forefront of the debate. And certainly we all are aware why that might be. Then we go genocide as a consequence of the breakdown of interpersonal and cross-generational relationships, which is, again, we can draw some similarities here. We have now seen how pandemic has severely impacted the cross-generational relationships, and how isolated and excluded some generations were and remain to be. So again, the social death theory really applies here very heavily. And then Claudia also worked on genocide as a consequence of assault on groups' culture. And the cultural conversations are the ones that we need to be having. The racism has been in a public debate fairly regularly, and but we seem to be really lacking any theoretical vehicles that could enable us to really capture what really is going on. So if I just try to wrap this very heavily theoretical point up, these three schools of thought have different qualities. The first, Patterson's, is most utilized for its ability to depict domination and for its analysis of intrusive and extrusive social death. Here, the intrusive social death is where the slave, in Patterson's work, intrudes into the community, coming from the outside in. So you might see some parallels when we might look at some research in refugee studies, that would be very, very applicable. And then Patterson gives us also extrusive social death, which is essentially a situation where the person fallen out of their community or was expelled from the community through social, economic, or legal forces and or failures. And as I said before, because Patterson's work offers us the Black Onto epistemological framework, it provides very unique and very well equipped base for really intrinsic inclusion. And then the second school of thought, represented by the interdisciplinary studies, offers a range of micro-universes of relational dynamics, in hospitals and elsewhere. You can find them everywhere, really. But most importantly, from this school, we may derive specific ways by which human beings may be enabled or prevented from sustaining their meaningful lives, their self-worth, their dignity, their quality of life. And how they might be profoundly exposed and made vulnerable. And so that is why the conceptualization of social death in death studies is quite so powerful. All right, and a third school of thought of Claudia Karts, as I said, and associated genocide scholars, gives us the focus on community level and teaches us much about the preservation of the group's identity and their social vitality, as I said, the opposite of social death. But also what Claudia gives us is that cross-generational, like Orlando Patterson does as well, that link of the continuity and also environmental context and cultural context. So it's incredibly rich and a powerful theoretical tool, which is not only interdisciplinary, but of course, when we put these three schools together, we're suddenly faced with thus far unrecognized theoretical ammunition, I would say, to really have a go at not only reframing the policy, but really, I would call it looking into intrinsic inclusion by default, on the basis of people's humanity rather than anything else. If you're human, you're worthy. And so it shouldn't matter what background or color or, if you wish, race or culture do you come from. And then that is why, and that is what makes this tool ever so powerful. Because unlike any other conceptual framework out there, it does not exclude. It includes by default. And oh yeah, my favorite addition. I could not go on without drawing your attention to these three specific works. They're not exceptions in terms of in terms of, well, they're exceptions in terms of being just as exceptional, but I could not theoretically sort of tuck them under any of these three schools, and that says more about my inability to theorize than anything else. So please forgive me if you know better. Please do come forward. But in essence, these three works are further using social death in a slightly different manner, in a different context, but add substantial weight to that social death conceptualization, and this is how. So Giro's work on the social death of social state, and I think you can start seeing the similarities here. We talk about structural violence, and a state violence is what Giro's concept of social death of social states captures most astonishingly. And Giro does this by using the work of Zygmunt Bauman, of those of you who are sociologically clued up. And you know, Giro signs, I think, as many as 8 of Bauman's works. And why is that important? Well, it is important because not only is it made clear that inflicting social death on the most vulnerable populations is profoundly wrong, but it further implies the moral responsibility and accountability, not only of those causing it, but also of those who are not actively opposing it. And this is Bauman's niche, inflicting this moral responsibility on all of us. And I appreciate this might be difficult, and it is most certainly a difficult thing to do. But in any case, that is the very, very core of his contribution here. And just to give you some taste of what Giro says, it goes as this: shame is now used to wage a war on the poor rather than poverty, on young people rather than those economic and political forces that undermine their future, and on those considered other rather than on the underlying structures and ideologies of various forms of state and individual racism. So that is Giro for you. Now, Gunther, Lisa Gunther wrote most astonishing work. It is her phenomenological analysis of solitary confinement that, if you are so inclined, please do have a read. The references will be at the end of the presentation. What Lisa Gunther does, she uses Orlando Patterson's work on the social death concept, but further, she also includes her phenomenological analysis. And for those of you who are not so familiar with what the phenomenology is, it's essentially the idea that that human beings are interconnected. And to bring you closer to that analysis, Gunther says, what happens when an intercorporeal living being, such as this, is confined for a prolonged period of time to a small enclosed space, isolated from other living beings and from an open-ended relations to the world? What are the ethical, political, and even ontological implications of such confinement? End of quote, from the page of 123. And this is really crucial, because you might be thinking solitary confinement, why is she talking about that? Well, dare I suggest that we've all been shut in solitary confinements for some time, maybe last 18 months. And then you might see further extensions here. We might be able to think about, you know, when I was reading Lisa's book, I could not stop thinking about care homes, because I worked in many, and I thought, why am I thinking that being old and shut in one isolated room makes me think of solitary confinement? And that is not to say that all the care homes are bad. Please do not misinterpret me on there. Please do not. But it is to say that in terms of pandemic, we have all been very isolated. And if you want to know more, please do have a look at that book. It's really, as I said, exceptional. And last but absolutely not least is, of course, Judith Butler. Judith Butler's specific term that I find most helpful. Not only does Butler use the term social death, but she also uses the term ungrievable death. And I think that is absolute essence of what social death means. And strangely enough, well, as far as I am able to ascertain in the book that I read from Judith Butler, she does not cite any of these other scholars when she says social death. And she uses it much more as a parable or analogy rather than the actual academic source. And I have not had the pleasure, and I would have loved to really, talking to Judith Butler, but I would love to know whether she knows this. And in any case, the contribution that Butler gives us here is specifically regarding the ungrievable life or death. And she says on the page 1, poignantly, specific lives cannot be apprehended as injured or lost if they are not first apprehended as living. So if certain lives do not qualify as lives or are from the start not conceivable as lives within certain epistemological frames, then these lives are never lived nor lost in the full sense. End of quote. Now, I appreciate the ontological conversation might be a bit too far out for some of you, but in any sense, essentially what Butler tells us is there are people whose lives and deaths not only do not count, but they are almost as if disregarded by default. And to give you some examples that Butler gives us in her book is when the children are being used as the human shields in a war zone. So I trust that what I have just presented here were some basic and very simplified, and I do apologize to all the scholars for simplifying their work in one sentence and probably not doing a wonderful job of it, but truly I hope you can see there is a serious, substantial body of literature that gives us all the vehicles that we need to be able to make these ungrievable lives grievable, and these socially dead populations made visible and structurally appearing in the policy frameworks and human rights frameworks and what have you, to protect them and to assure that their lives are seen and perceived as worthy. So now I'll move on to the more analytical part of the talk, which essentially takes all these theoretical frameworks that I hope I didn't just send you to sleep with, and applies them to what has been happening around COVID-19 pandemic in relation to the Black, Asian, and minority ethnic communities. Excuse me. So, although it's been repeatedly evidenced that COVID-19 disproportionately impacts Black, Asian, and minority ethnic communities, according to Public Health England, the UK government has remained slow to offer specifically tailored support. Yet the likelihood of testing positive and the consequent risk of being admitted to ICU for COVID-19 are greater in all ethnic minority groups in the UK compared to with whites. And the relevant factors may include poverty, education, household size, population density, geographical location. I have evidence for all this in my paper. Please do refer to it for further details. Likewise, referrals to palliative care for BAME patients, especially women, take longer compared to white and ethnic patients. Still, the UK government's race disparity unit, despite publishing the first quarter report on a progress to address the COVID-19 health inequalities, omits any discussion of the impact of structural violence and racism in dealing with the pandemic. So, beginning with the first whole thought of Orlando Patterson, and his conceptualization of social death, we may be reminded that the social death can result from domination, racial violence, or an assault on Black lives and death via cross-generational, physical, symbolic, and structural violence. And the slow-coming social policy that would effectively protect BAME communities and the delay in referrals, along with the lack of effective strategies, may for some lead to death. And this is not necessarily due to the virus itself, though it will inevitably play part, but more so to a lack of effective social infrastructure, welfare, and other measures to protect BAME communities. As such, social death is preventable and should be prevented. And in this same context, the second school of thought, represented by the interdisciplinary studies of death, reminds us that dehumanizing practices through which a person's value is diminished and consequently impacts on the perceived worth of their life. In other words, some lives are perceived as deserving to be saved and some might be less so. In terms of the third school of thought, Claudia Carr talks about communities and cross-generational impact, which we will yet see moving across the time. And mentioning the time, I'm painfully aware that I should move forward. So there is much more to say, but I'll leave that for our discussion. So just briefly, I think, a few points about how we might apply social death theory to the situation that has occurred in the care homes during the pandemic. So this issue pertaining to preventable mortality of care home residents include the underreporting of the COVID-19 death in the care homes in the first 8 weeks of the pandemic, and the estimate of 25,000 patients discharged from hospitals to care homes in England between the 23rd of March 2020 and the 15th of April 2020, with an unknown number of patients discharged to care homes later, and the inadequate testing of all involved. And this is according to Daly 2020, Mitha 2020, and Oliver 2020. Although the idea of freeing the hospital beds may have been well intended, the deaths that resulted from this decision, although appearing under the code of COVID-19 in the international classification of the disease in the context of preventable mortality, were in fact deaths by social causes ensuing from the inadequate social policy and uninformed decision making, and possibly there is also the question about underpinning the diminishing value of the elderly lives and death. And I appreciate this is very sensitive, and I hope it will not get misinterpreted, but by no stretch of imagination am I implying that people living in care homes are socially dead. That is not what I'm saying. What I am saying is that the transition from the hospitals to care homes and the lack of testing and facilities and all sorts of other resources meant that some of these people were infected and consequently died, yes, of the actual disease, but as a consequence of social actions or inactions. So these are socially caused deaths as opposed to the actual sort of a cover-up of a COVID-19. In terms of specific applications, I'm just going to move on, I think, to the concluding remarks, mainly in the interest of time, and we can unpick some of this in our discussion. So really, I tried to really demonstrate how powerful the social death theory may be, and specifically I aim to challenge the conceptualization of avoidable mortality of the OECD, which uses the ICD to categorize causes of death and thus omits from it conceptual frame the social causes of death, the social death, and specifically preventable mortality, which can be prevented through public health measures, was the focus of the analysis. And to kind of open up our upcoming discussion, I think that there is a greater question that arises, which is how we may change our approach to inequalities, injustices, exclusions and oppressions, and move beyond established sociological categories to enable those who remain not to be seen, as it were, in the policy sense, or not to be there altogether, to become structurally, legally, and policy visible and accounted for, and indeed counted and grievable and protected. Thank you so very much for listening. And here are my contacts if you wish to take up some further conversations later.